We are AWP.
Hello, welcome to this edition of We Are AWP Voices, the podcast brought to you by Avon and Wiltshire Mental Health Partnership NHS Trust. Today's episode is being recorded on the back of Social Work Week, so we thought we'd invite three of our social workers here at AWP to come and talk to us a little bit about the sort of work they do, and to break down some of the myths and stereotypes, and to highlight why the role is vital within the NHS and community mental health. Really pleased to be joined today by Emma Louise Rowe, Phil Rhodes and also Evie Chambers. Welcome all, thank you very much for joining us. Perhaps you could tell us a little bit about the roles that you do.
Yeah, hi, I'm Emma Rowe. I'm a social care lead for Baines, Swindon and Wiltshire for AWP. I've been a social worker for over 23 years and always predominantly in mental health.
Hi there, I'm Phil Rhodes. I'm Head of Social Care and Safeguarding and Principal Social Worker for AWP. I've been in the Trust now for 21 years. Always wanted to work in mental health, didn't want to work in any other field. So it's been a really good 21 years.
And I'm Evie, and I'm a student social worker on the Think Ahead programme, which is a fast track masters. So started that in July last year, and will qualify July this year, which feels scary. I'm currently placed in an older adult community mental health team. Just learning the ropes.
What's one thing you wish more people understood about mental health social work?
I think there's an assumption that as a mental health social worker, all we do is detain people under the Mental Health Act, and that we're all approved social work, the old style approved mental health professionals, but that's not the case. We work in a very diverse range of services right across the organisation, across all different specialties, such as our children's teams, adult teams, older adult teams, bring a whole range of skill sets into the services, especially around legal literacy, a much more holistic, person-centred approach. I think we bring the social aspect into social work rather than the medical aspect, and I think we help expand the viewpoint of looking at somebody's life and all the different components that someone lives in, and how we can better engage those in a more holistic way rather than focusing on someone as a diagnosis.
I completely agree. I think moving away from kind of a lot of negative press about social work, I think the one thing I would certainly change is thinking about the stereotypical views of social work, particularly driven by the media, which can be really negative. I think we quite often get blamed for a lot of the kind of things that happen that are pretty bad and negative in society. I think it would be great to be able to be in a position where we start to change the focus, and really kind of get more of all the brilliant stuff that we can do, and how we support working within, particularly even within the NHS, which quite often people forget that we are. We all just assume that we work for a local authority. So actually getting more understanding out about the fact of how many different places we are working in, and exactly like what we can bring, I think is extremely positive. And I always like the fact of touching on what you said about being able to challenge the medical model, the medical perspectives, and really think about much more about understanding the person, seeing them in their own environment, what's important to them, and thinking about really how to support and work with that person rather than just the illness or the diagnosis or the medication or the symptoms. So I think that's really positive.
Definitely, we're not just about housing and benefits, are we? I think that's another real misconception about what we do, and actually those are areas we don't really touch anymore because they're specialist areas in their own right, and I wouldn't want to be giving benefits information to somebody and get it wrong. So I think it's a real misconception about what we do.
And we just get, it seems from my short time, that you get so much more time to build relationship with people, whereas perhaps in local authorities it's kind of in and out, complete an assessment. It's like kind of like treadmill of social work, which is really important in some situations. But in mental health, you just get that time to build relationship. Like Emma said, find out who that person is and perhaps who they were before their mental illness, and then really like uplift their voice and things, and in medical discussions. And be an opportunity to kind of bring that perspective.
Edie, you mentioned your short time with AWP and in social work, obviously still studying with us at the moment. Perhaps you could tell us a little bit about your role and how it came about.
Yeah, so it's an amazing programme actually. It's a fast track Masters in Social Work, and it enables you're on placement in the trust for this first year where I'm studying as well. So you have a mixture of attending university, and some of that's online, and then some's been in person as well. And then alongside that, we're on our placements, which have been mostly in AWP, but we also get a contrast learning experience within children's services in the local authority. And then once we qualify in July, so that's after your first year, you then become an employee of AWP for your newly qualified year as a social worker. And what's amazing about that is you're guaranteed that role as well. So, you don't have to stress too much. It's like one extra thing you don't have to worry about. But also I think the amount of experience that we've been able to gain on our placements has just been so extensive. And I know it's all routes into it are good, but sometimes when you speak to people on the degree level programs, they haven't necessarily been able to kind of hold as much responsibility as we have, or be supported in the same way, just by the nature of having shorter placements and things like that. So I do feel we've been able to get so much experience within these teams in such a short space of time that kind of going into our newly qualified year doesn't feel too daunting. And there's been so many layers of support within that programme, like within our teams. From Emma, we have a consultant social worker who kind of looks after the students on the programme, and we get really regular supervision. So it's just felt really held in that sense, and just enabled you to like build your confidence in what you're doing.
What was the main things that drew you to this career?
So it was through several different roles as a support worker, with completely different groups of people. I was working for an outreach team with people who are street homeless, and then working with young care leavers. And I think in all those situations, mental health is so prevalent, and I just wanted to know more, learn more. Build my knowledge so that you could support people to a greater extent, because you kind of felt like there were confines within your support worker role. But really it was just that being able to connect with people. That's just something I love, just like building those relationships. So that is something that so far I've been able to really enjoy in this role, is that there is space for that within mental health social work.
I think that's a key difference for me as well, compared to local authority. But there's nothing, you're absolutely, as you say, it's really valuable, but I think you're definitely right. You get a much, especially in our recovery teams and our older adult community mental health teams, you get much more of an opportunity to build those relations and really get to understand somebody better and their family and the system that they live within. I think that's what really drew me in as well, especially into mental health. You get so much more opportunity to do different pieces of work with people, which I think really help improve people's lives, rather than just a review and a package of care and move on to the next person. You get to spend, you can get several years with somebody and get to really know them, and they value that relationship as much as we value the relationship with them. So.
Yeah, definitely. And I think we can bring, like I said, that different perspective where sometimes that can be lost. And, touching on what you just said as well, it's so important that, we really listen to the people that we're here to support, that we also help them if they don't have a voice. Quite often that's lost, and it can be really difficult navigating systems, whether that be health systems, social care systems, and that's even harder, I think, for people who are, under mental health services, just trying to get through, and understand the system can be really, uncomfortable, can be difficult, it can be challenging. And I think having that support by their side and being able to, get them to a place where that they can, live more of an independent and successful life and achieve the things that they want to do, which again can be really lost, particularly with, having a mental health diagnosis. And that sometimes as well, what often happens is there's a lot of kind of negativity surrounding mental health, and still I think we're still as a society, really behind in really promoting and recognising, how incredibly difficult it can be living with mental health illness, and actually how much more is out there to support you, which people still don't know, even in their local communities. And I think that's a really key part of social work.
Definitely.
Is understanding communities, understanding where people are in those, and connecting people into those communities, because quite often become isolated and separated from a lot of the things that they used to do or be a part of because of being unwell. So I think that's a real strength in again, the social work role.
So I suppose we ought to go back to the start and just sort of talk about and establish what is a social worker.
Gosh, where do you start? I think it's such a varied role. I think depending on what the kind of the teams that you're in, like I said, we could be based on inpatient wards. They could be based within the community settings. We've got all different specialisms as well that people work within. Would it be
Forensic
services.
I think they're supporting our service users who are in secure units, and a lot of their work, I guess, will be around supporting any report writing, working individually with the people on the ward to support them and help them work towards discharge potentially when they get to reach that point, so they can transition back into the community. Yes, there's all sorts of different roles. It could be some of us might be approved mental health professionals, so we might spend some time on shortened to AMPs, so we might spend some time working with the local authority to support mental health act assessments. That's one of the responsibilities we might have. It could be, depends what teams you work in. It's so varied. I mean, assessments.
Yeah, in the older adults team there is kind of quite a lot of assessing people's care and support needs, and do they need a package of care, so still that more traditional view of social work, I guess, but then also within that trying to kind of pull on their social networks and what other resources do they have available, pull out their strengths as well, and rather than being deficit based, but actually what do they have that can really help them in their communities, reconnecting people if they're feeling isolated or lonely, pulling on other services in the community, befriending services. So kind of looking at a really holistic view of all of their needs and where can we just support to put something in place.
The role of social work, like I said, does vary in terms of across AWP. We work with 6 different local authorities, so in each of those kind of locality areas, things can be quite different. They can look quite different. So quite often there's a key part of work that involves kind of helping someone to navigate the system and what's available to them. I think it's really important that as social workers we understand the communities that we're working within, and that's kind of just not necessarily how we're connecting people, what's available around their local areas, but there may be certain challenges for certain people in certain areas. There's, for example, Wiltshire is very rural, so quite often people feel quite further isolated, living in kind of more the smaller villages without their transport connections. So really thinking about getting to know people and how they can start to explore, different transport options and being able to access support and services. And actually just, for some people, it can be the smallest of things that can make the greatest difference. We spoke about isolation a lot, especially coming out the back of COVID. There's been a lot of recognition to how much of a negative impact it's been for people in losing connection with family, friends, whether it be through social activities or just, within their own kind of neighbourhoods. So quite often social work is really important to be at the heart of that, to help really understand how that connection works and trying to encourage and support people to re-access that in the best ways that they feel it is possible and what they actually want. And quite often as well, we battle for the person's voice to be heard, and we shouldn't make assumptions about just because they have a certain diagnosis that means that they should be treated in a certain way. We really want to hear what that means for the person, and you spoke about the importance of relationships and building relationships, understanding the person and speaking to them and exploring what they want and not necessarily the traditional viewpoint of what they should have.
Yeah.
I think that's really, really
Definitely.
important.
That holistic viewpoint of somebody, I think, is
Yeah.
really important. Not just seeing one component of them and recognising that there's many different facets to a person, and trying to work with those and engage with those and their system around them, so their family, like you said, their communities, and what that means for them, and how we can use that to support them on their journey to recovery, and living their best selves. And basically, I think that's what we're trying to do.
Yeah, absolutely. And I think that's where we come across a lot of areas in people's lives, whether it be going back into education. We're working with and liaising with kind of education providers, whether it be they want to they're out of work, they want to get back into a job role or something. We can work with certain agencies that can help support people to develop more skills around, whether it be interviewing, navigating the whole systems of applying for jobs, and we also work quite closely with our multidisciplinary colleagues. So it might be that we've got occupational health colleagues going in, working with people within their own homes, to be able to access more within their homes, building skills, whether it be cooking, whether it be being able to even meal plan. Sometimes that can become such a barrier for somebody who's been unwell. So the things that quite often people take for granted, which are what we see as daily living, when someone can become unwell, can be such an impossible task. And I think, again, as social workers, we can quite often be the people that can get in and recognise that, understand from a person, and start from where the person is best comfortable, in order to rebuild those skills and get them living how they want to live and really thriving again. So
I think we're good at navigating complex systems and supporting people to move through those, because they can be really challenging. I think also, especially, I feel we act as a bit of a conduit sometimes, especially between the local authorities and the trust, is essentially, especially in our integrated services. Well, by those I mean teams where the local authority and AWP teams work as one. We've got 3 areas within the trust that are set up like that. I guess we're much more adept at supporting Care Act assessments, for example, and the information that's needed for those, which is support somebody in their journey, and supporting our health colleagues with those, completing those or understanding those. I think there's also something about the legal literacy we bring into teams, and I think especially around Mental Capacity Act and supporting those Mental Capacity Act assessments and best interest assessments. And I think Emma's a best interest assessor, which is another role that as a social worker, a lot of social workers like to do, because I think it's a really key role in supporting someone's rights and safeguarding someone's rights in really challenging circumstances where they lack capacity to make decisions on their own behalf. So I think we bring a real skill set into that arena, which can be really challenging.
Yeah, definitely.
Perhaps you can say a little bit more about that role, Emma, what that involves, what that is.
Yeah, so it's a role where you undertake some specialist training, and predominantly the actual role itself can it be in AWP or it can be within the local authority. The actual statutory duties sit within the local authority in terms of the team and who oversees all of the assessments. However, we can sometimes have opportunities to train to undertake the role, and that's basically understanding their rights, making sure that if there is in a situation where their rights are being deprived, so it's called a deprivation of liberty, that we are assessing that, we're working with the person to ensure that whatever their wishes may be or what they would have been, that they are their voice is heard within that, and that they aren't subject to any unfair treatment, and that we're working with their families as well. And I think that's something that's quite often can be missed, and again, social work I think are really good at understanding that the person doesn't exist on their own, that there is a network of people generally normally around them. So understanding carers as well, making sure that they have access to carers assessments and support services, because quite often that's a really key voice that isn't heard. And if you think about the huge amount of unpaid support that carers give, day to day, that doesn't often get recognised. So I think as well that's a really important part of the work that we do. So it's really, understanding how we can best support the carer, because if the carers are supported and they feel well, then they're able to continue caring for their loved one.
I bet you see that on your older adult teams, don't you?
Yeah, I was going to say that's a really nice part of our team, and having the space to meet with carers, and I think just give them time to speak about themselves and to reflect on the impact of their caring role, where maybe they have to put up quite a strong front, or for lots of sometimes they're quite kind of a linchpin in the family, and they're often holding up many people, not just the person that we're working alongside, and just giving them a space where they don't have to be that, and they can cry and get upset and be really honest about how it's making them feel, where they might not be able to say that with other people. And then from that, hopefully being able to access resources, signpost them to support in the community, or within our teams they often have things they can offer, so some psychological support for carers and things, so we're linking them into that kind of based on those conversations, which feels really important.
I'm just thinking about how much mental health's advanced since I first started. I'm just thinking back to when I started, there was a Barrow Hospital, for those of people that might remember it. It's a housing estate now, and thinking about the units there and how we would never have people in those types of units, with bedrooms upstairs and out of sight, those types, and smoking in the wards, where service used to smoke all around the wards. You'd never even dream of that, those types of things occurring. And the move to Callington Road Hospital, it was all sparkly and bright, and the setup was so much better. And thinking about the way we work with people, moving away from trying to integrate people more into the community and not just have people in hospitals, which I think has been a really important move. And I think the legislation's also changed or advanced over the years as well. I mean, for example, adult safeguarding was never on a statutory footing back in the day. With the introduction of the Care Act, it became on statutory, which I think has been absolutely brilliant in transforming safeguarding and ensuring it had the same oversight as children's safeguarding. Thinking about the Mental Capacity Act, I mean, gosh, that came in 2005, and that just transformed the way we work with people and think about their rights when they're unable to articulate them themselves, and the protections for people. I think social work's been right at the centre of that, and supporting the whole system around that, and the literacy we hold around the Mental Capacity Act and how we work with that. We've seen updates to the Mental Health Act, which has changed the way we work, and again, I think promoting the rights of people. I mean, there's still a lot to go. We're nowhere near where we need to be, but I think that I've definitely seen those changes incrementally over the years, and involving people much more in the way we design co-production was a word that was never even came up when I first started. And think about I'm thinking about the Kingfisher unit, which is our learning disability and autism unit, and how co-production's been at the heart of that. And I think that's a real ethos of social work, about the way we engage and work with people. We don't do to people. That's not where we come from. It's working alongside people and walking the walk with them. That's how I've always approached it as well.
Definitely. And I think that's where services have positively really developed in really thinking, like you said, about co-production, having people that have used services involved in the service design, what they would want, what's worked well for them, what hasn't, and how then we can look at tailoring kind of the way that we work and the services, our teams, to meet that, because at the end of the day, the people that we work with are the experts. They're who we need to work with and learn from, so that we can improve our services and offer a more diverse range. And when I look back, I think, when we started 20 years ago, more, it was very based around community. We had kind of community mental health teams based in the communities with lots of kind of things happening. I think, the building that I worked in was an old, beautiful old house, and it was thriving with different activity groups. We had people in the community volunteering, coming in, and had a gardening group, we had a cooking group, we had a crafts group, we even had a kiln, so we had a pottery group.
Wow.
All of this running, which was incredible. So the amount of things that we'd be able to offer within that space for people, whether it be, to come and engage in activity and be around people, and that they can access that because it was within their local community. And I think over years it's been really sad to see so much of that close down and us change, and we've come away so far from communities into kind of office buildings and clinics and hospitals that I think there's that sense of losing touch. But what is really positive now is we're kind of going back full circle with all these kind of super surgeries that are being built, health centres that are expanding so that they will offer so much more than just her health, that they'll have people able to go in and offer advice on housing, on advice on something that's happening, whether it be a safeguarding, something they want to report in the community. They're going to be a much more accessible hub where people can even just come and ask questions or come and have that contact, and hopefully that will really improve. I think the barriers that still exist for accessing services. So I think no matter what, even talking about the Care Act, when that came in, it was incredible because it offers this framework where everybody is entitled to an assessment, regardless. And if that assessment doesn't necessarily deem that someone will automatically get services, it can provide signposting, and it's that first step in being able to kind of start that kind of opportunity for someone to get access to services or get help or support. So I think that really did break down some of the barriers that exist before, particularly around where does someone even go, where does someone start, and often people would, the kind of natural place people would end up was with their GPs, because quite often a GP was well known in communities, so people would go and see their GP, and then those mental health conversations might have started from that point. Whereas I think that's developed hugely now, because I think that more people have an awareness about mental health and a confidence to ask certain questions where they might start to see that someone may be struggling, and have that confidence and that to be able to ask, whereas quite often people wouldn't have even done that.
And I think that's a bit of a double-edged sword, because we've seen increase for services increase massively, I think, since the time I started in mental health. And it's really great to see a lot more people being able to talk about it, but it's trying to make sure our services adapt and the way we work adapts to support everybody that needs access to a good quality service. I think that's a real key piece of work that we can do as social work. And I'm thinking that, I'm thinking about the 10-year NHS plan, and thinking about like ward community, for example, and how, we can think about, how we target social work interventions to support people's who are moving out of inpatient units back into the community more successfully. How we can support people accessing their communities more successfully. Just that more holistic approach where it's not just focused on a treatment or a diagnosis or a medication, which I think helps people on the whole rather than just treating part of what's going on for them.
Absolutely, and I think this is where quite again often that can be lost. So a real strength in social work again comes from that relationship building, understanding the person, and really working alongside them to understand what they actually want. And whilst we work really well in our multidisciplinary teams, because we can draw on the strengths of other professionals that we work with, and I think sometimes actually achieving the best outcomes for people comes from a shared group of knowledge and experience and skills. And I think again this is where social work can quite often be that bridge in order to kind of access more different types of services, or access different professionals that may be able to help them at different times in their lives, whether it be kind of therapeutic interventions. We spoke about actually specialists if they in housing, and we're not necessarily the specialists in supporting with housing. We know where to go, and we'll
safeguarding as well. So it's sort of a key aspect, making sure people are protected from harm where we can do that, and supporting, identifying abuse, and accessing the right pathways to support people around that. I think it's a really key aspect of what we do. And I think although within the trust we've got a safeguarding service, we're not the statutory provision of safeguarding that our local authority colleagues are, but we're keen supporting that pathway and supporting our colleagues as well around identification of abuse and what we need to do about it and where we need to go to the local authority. So I think we've got quite a key role in that as well. Yeah,
and I think again another skill particularly in social workers is I think going on often our we talk about a lot that we go on our guts, we go on our instincts, we probe that a little bit more. So I think sometimes, particularly when we think about hidden harm, we think about safeguarding, and then it's further complicated when people are suffering with mental illness, and sometimes that can be even a greater barrier in order to recognise that someone may be suffering from harm and abuse. So asking those questions, thinking about our own curiosity to kind of go that bit further, to go and see people in their own environments, in their home, to, like I said, if you can build that relationship, have that more trust, people might be more willing to be able to open up and ask for that help or support. And I think that's another area, isn't it? We work within drug and alcohol services and specialist services where you've got further I suppose we've got stigma attached to that, and addictions hugely impact with someone's mental illness, and so working across those all those services really help provide a much more, like you say, kind of holistic approach to someone's care and support. And sometimes that quite often is missed, and again there's a barrier, isn't there, sadly, these still, I think personally I would say, in how we work in mental health with drug and alcohol services, and working really together. And that's a key thing I would hope really develops and kind of improves going forward. And we touched on the real challenges with financial pressures, and I think this is where for the NHS we really feel that pressure and stress for the first time in terms of finances, and how that is really impacting on the services that we can provide, and we're having to adapt. And I think again this is where social workers are quite
we're used to that, aren't we?
We're used to that. Always used to having to deal with smaller budgets, finding
being creative.
Exactly, being creative. So I think that's a real positive. And I think sometimes as well there's something in social workers that will not just that champion someone in terms of their rights and that, but also pushing back a little bit, being a voice and pushing, advocating.
What keeps you passionate about the work that you do?
Positive outcomes. I think being able to work with people and know that you've been able to help them make a difference, change, and be able to recover and be able to achieve the things that they want to do in their lives, so that they're meaningful, so that actually it's not what we're telling them or services are telling them they should be doing. It's something that's really important to them. And when I reflect back over my career, there are key kind of things that I will hold on to, where I've worked with someone and there's been some incredible changes for them in their life, and I've been a part of that. So that's something that, again, being able to overcome that stigma of mental health and come through that journey of mental health, helping them navigate services and be able to not need services and be in services anymore is incredible. And that also drives my passion.
I think completely agree. You just reminded me of of someone that I used to work with years ago, and we spent a lot of work on supporting them, getting the right care into place, and then I remember a good few years later, I was in Bristol city centre, and someone came up to me and tapped me on the shoulder. I turned around and I was like, a little bit awkward at first because you're out of a work context, but they weren't in service anymore. Their lives had changed from the work that we'd done in the past. It was really heartening because sometimes you don't often see someone's life a bit further down the line, and they got a job, they were working, they've got a partner, they've got a real stable, and they were really happy, and they thanked me for the work that we'd done at that time when they were in a really difficult part of their life. And it's those moments that make you think, gosh, I am doing something really positive with people, and that's why I came into it, to help help people improve their lives, or support people, help people, whatever, however you want to phrase it. But that's what keeps me going. And I think, although I'm in a more of a senior role now and I don't do so much frontline work, part of my role is I get a lot of satisfaction out is enabling others to support people appropriately, or protect or safeguard. I obviously oversee our safeguarding provision and making sure we're giving the right advice and support that protects people and and makes their lives better. So I really get a lot of pleasure out of that, seeing people's lives transform and not need services anymore, and just live their life. Do you know what I mean? Live their best life, and that's what brings me satisfaction.
Yeah, definitely.
I mean, I'm at the very start of the journey, so you'd hope I'm still passionate at this point. But I guess on a much smaller level, even when it's not the big changes, it's being able to be really present for an hour with someone and have a conversation they might not have had anyone else to have that with, and see really small changes kind of day to day, and just having a real scope to do a wide variety of work. These guys were talking about being creative, and you really you're not necessarily stuck with just kind of statutory things you can offer, but actually looking into their wider life and community, and what does this person want, and how can we support them to achieve that.
What are the current challenges for mental health social workers?
I think there's some key changes in legislation coming up, so when they eventually come through. So I think when you think about the Mental Capacity Act and the move from deprivation of liberty to the Liberty Protection Safeguards, a bit of a mouthful, and I guess the role that we'll play in supporting the implementation of that within the organisation. The Mental Health Act changes, when they've eventually come through, I think we'll have a key role in that as well. And I think thinking about the NHS 10-year plan, we talked about hospital to community, but there's analogue to digital, and what was the other one? It's got my head.
Crisis to early intervention.
That's
from
it.
Crisis.
And I think we're really good at those. I think there's a lot of parts of that where social work can support. I think especially around early intervention, that fits quite well into the models that some of the local authorities use. When you think of the free conversation model, where you're looking at a much earlier stage about what's the minimal, what can you do that will support somebody, not have to come into service, which can be very stigmatising in themselves within their own community, and supporting them to do that. So I think we've got quite a few roles going in the future, haven't we, in terms of thinking about how the system is going to, the transformation of the system will occur over the next few years.
Yeah, definitely. And I think that touches in on what you were just saying, Evie, certainly in the fact of, sometimes just the smallest of difference can make the biggest of change. And I think that starts from a conversation and from understanding someone. And I think we can never take for granted how important that is. And I think that is the foundation of all the work that we should be doing, is just taking it back to that relationship, that conversation, that what is important for that person. And I think if we can hold on to that, then any changes that come, I think we'll be able to manage and deal with and navigate. But I think keeping those core kind of sense of passion and making a difference at the heart of everything that we do and for the person is going to be key. I think it is it can feel worrying, because I think, when there's ever decreasing, money, and it isn't all about money. It's like we can be creative, and we can find other ways of supporting people that doesn't involve kind of paid for services. Absolutely.
Absolutely.
But I think when we're faced with that increasing demand as well, with fact more people wanting and needing access to services, we need to really think about how best that we can kind of, come back to that. Like what can we do with less money, less time, but keeping the person at the centre of everything.
Social workers are really good at navigating systems. I think, as I sort of said earlier, I think trying to be creative and I guess in more challenged times is working together much more as a system, and by that I mean not just relying on, say, local authority partners or the NHS. We've got amazing third sector providers that we work alongside, and I think a lot of the work is working creatively with them and holding that person that we're working with at the centre as they're going through these different organisations, and not having to tell the story over and over again, and it's much more of a fluid process rather than I've got to make a referral here, make a referral there. So I think that's how things have changed a bit as well since way back when. I think that's something we need to hold on to make people's journeys much more smoother in these challenging times.
Yeah, and hopefully I think improvements, fingers crossed, in all technologies and, dare I say, AI. Yes. Will hopefully kind of just, if we can use it in the right way, really help kind of reduce the amount of time that, we as professionals have to do in, writing up notes, writing up assessments, and then, and I really do see that positively affecting and increasing the amount of time that we have to actually spend with people, which is absolutely why we do the jobs.
Definitely.
That time we'd much rather be out with people, supporting them, than, typing up and doing our admin. So that's a real positive, and I think that that will make a difference, and that will come in. And the great thing is that we know that, again, in this profession, the most important thing is that person contact, being with people, and AI can't replace that.
Yeah, I hope, as Emma was saying, that it comes back into those more kind of community hubs, and it being more accessible for people to kind of reach out for help and perhaps get earlier bits of intervention before it comes to the point of like needing secondary mental health services. And again, I'm hopeful with AI that as social workers we will get more time to be with people and be out in communities. And I think particularly in society in general, people are a lot more isolated as well, kind of have less of that wider network, and perhaps the role of the social worker can even more focus on strengthening those kind of community and social networks for people, so that they can be held by those and don't necessarily need those more intensive services further down the line.
If you could leave our listeners with one message about mental health social work, what would it be?
For me, it's a really mental health social work provides so many different opportunities. I think working in the NHS gives you I'm not saying local authority doesn't have lots of pathways, it does, and that's not critical of them, but I think there's so many more different components working with the NHS and specialties and teams we can work in. I think the variety I've really enjoyed the variety over my career, and not being I get stuck in one team. I've moved across the organisation, across the 6 different localities. I've worked in a whole range of teams, and I've found that so enriching in my over my career so far.
Evie?
I think just from what I've seen so far that it is so collaborative, and it's not about enforcing things or how someone should live, but it's really about getting to the heart of who someone is, and how can you allow them to live the life that they want to live, which is exciting.
Yeah, and I think it's really difficult to say. I'm thinking about what was the one thing that I could say about mental health and social work, and I think for me it's just the power that social workers can support the people that use our services in order to have that voice, make the changes they want to, and to, you know, navigate mental health systems and that, to get the best of what they need to live their best lives. And I think that's the key thing I think I would keep coming back to, and just seeing the positive outcomes and working with people and getting to know people.
I think mental health social work is the perfect place to do that. I think it gives us that opportunity, whereas some of the other fields, I guess, wouldn't give you that ability to build those relationships with somebody over a period of time, rather than in and out type of pathway, which I think is so rewarding, and gives us that better understanding of somebody.
Yeah, and seeing the person and not the illness, which I think is something that always sticks in my head.
And just being completely non-judgmental about what, you know, about that person and what they want, how they want to live their life, and just being able to really hold that kind of neutral lens, so that it's just their voice coming through.
Evie, Phil, Emma, thank you so much for joining us today to talk about social work and the role of it within the mental health service. Thank you all for listening. Please join us again for the next edition of We Are AWP Voices.